So today I'm going to address the question of telesurgery. Is this going to be something that we see as commonplace in the future? So what is telesurgery? Telesurgery is the idea that a surgeon can be doing your surgery from hundreds or thousands of miles away by controlling a robot. So to understand this question, we have to understand first what is robotic surgery and what is laparoscopic surgery in general. So you have to do a little bit of history here. So classically, surgery was always done with big incisions, open the belly up all the way so you can see what you're doing, all right? Well, in the 1980s, there was the invention of laparoscopic surgery, which was the idea that you could actually fill the belly with CO2 to create space and make a small incision to put a camera with a light source in. You could see everything through that one small opening, and then make two or three more small openings where the surgeon can basically control through long instruments, do the surgery from the outside. This really gained popularity, at least in the United States, in the 1990s, and is still done today, but less commonly. So laparoscopic surgery is a huge invention, definitely pushed surgical innovation forward, but it's technically very challenging from a surgeon perspective. Basically, you're looking at a 2D screen and you're doing the surgery from the outside with these very long instruments. It's kind of like chopsticks. So surgeons who trained in the 90s are very technically skilled in this, but it's still very challenging to do complex surgery this way. So in the 2000s, we saw the invention of robotic surgery. So robotic surgery is really just an adjunct to laparoscopic surgery. So instead of the surgeon holding the camera or having assistants hold the camera while the surgeon holds these instruments, basically you have a robot that is controlling the camera and these robotic arms. So when I say robotics, first of all, it's important to note that I'm not talking about AI. At least in the current term, there's no AI use in robotics in common clinical practice. The robot is completely controlled by the surgeon. So the robot camera goes through a small laparoscopic incision, just like the laparoscopic camera, generally has two HD lenses, which give the surgeon 3D vision. And instead of the surgeon standing at the bedside controlling the arms, the robot basically controls the arms. Well, really, the surgeon controls the robot. So the surgeon classically sits in the corner of the room on a console where you basically play a 3D video game, and by playing that 3D video game, you control the robot's arms. And this really came out in the 2000s and became extremely popular in the 2010s. And now in the 2020s, it's very commonplace. Pretty much every hospital that you see in the US has at least one robot. And it's usually the 𝐷aVinci system is the most common type. And it's not just urologists, it's general surgeons, gynecologists. The robot has become ubiquitous now. But it's very interesting because essentially the surgeon can do the surgery without ever really touching the patient. I mean, somebody has to touch the patient at least to make the small incisions to put the robot arms in, which there's some technical skill needed there, but most physician assistants can be trained to do this, or surgical residents. This doesn't require that much surgical expertise. So then you get into the question of, well, does a surgeon actually need to physically be in the room? Or can we have a surgeon who's hundreds of miles away or thousands of miles away even controlling the robot to be able to do the surgery? Now, there's a lot of potential advantages to this, right? You could reach more patients, especially in rural areas. You could use this in a military setting where people out in a military hospital have the ability for the surgeon to still do their procedures. There's a huge role to use it for educational purposes, telesurgery, where the surgeon can basically not be there but show people how he's doing the procedure. So there's a lot of potential advantages to push this forward, but obviously a lot of important barriers that need to be considered, right? One is the technical barriers, right? So there cannot be any lag time, right? It can't be that what the surgeon is seeing hundreds of miles away is actually 0.1 seconds later than what's actually happening in the room. And same thing with the effect, right? If the surgeon moves the robot console arm, it has to be immediate that that effect is seen in the actual patient. And this could be very important in some certain types of surgeries where things are moving. Maybe not as important in other surgeries, but in general, you have to have very minimal lag time, which with advances in technology has become more and more doable. The other one is the security of the connection. And I mean security in multiple ways. One is it can't work 99% of the time, right? 99% is good enough for most things that we use internet for, right? If you're streaming a movie and it works 99% of the time, that's great. But for surgery, 99% is not good enough, right? You can't have a technical error cause the whole thing to collapse. So you need to have pretty damn close to 100% guarantee that this technology is not going to fail. The other point is cybersecurity, right? That this thing can't get hacked, that patient info can't get hacked, the connection can't get hacked, and so forth. That has to be all super secure. So that brings us to the next point, is that you need to have a backup in place, right? If this is going to happen where the expert surgeon is doing the procedure from hundreds of miles away, if not thousands of miles away, then there has to be somebody in the actual operating room who can safely finish the surgery, or at least get us out of a dangerous situation, right? So that sort of begs the question, well, if the person in the room knows how to do the procedure, then why do you need the expert surgeon there? Well, there can be technical advances that this person is trying to show somebody. There can be kind of some proctoring that's going on. It can be that the person in the room has some general knowledge that they can safely handle an emergency, but maybe not do the surgery to the same extent as the expert. But this is where you get into some of the ethics of the situation. But definitely everybody is in agreement that there has to be somebody in the room that's a surgeon, that's technically trained, that can handle these types of emergency situations if something happens with the connection or something like that. And this is really something that has become a reality. The European Association of Urologists released a long statement of guidelines on what exactly should be in place if telesurgery is going to happen, because more and more it is becoming a reality, both for patient care, like we talked about in rural areas, but also for teaching and training purposes. So this is a sort of a new wave of surgery that nobody thought really would even be possible 20 years ago, that you could have a surgeon on the other side of the world essentially doing surgeries on people. But it is more and more becoming something that is likely going to happen. It may not be commonplace that this is how every surgery is going to be done, but there's likely going to be certain scenarios where this is factoring in, and it just has to be done the right way. But I do think that this is coming, and this is part of the future of surgical technology. Now, the next question from there is going to be the role of AI in doing robotic surgery, right? Am I going to be able to have the robot no longer even need to have a surgeon at the console controlling it? Can the robot learn to do the surgery itself? And a lot of AI experts are saying yes for maybe certain types of surgeries for now. And there's some experimental studies in animal cadavers and so forth is showing that some of these robots can do some of these basic surgeries. And with time, they're only going to get better and likely possibly outperform the actual expert surgeons. Now, again, you're going to need to have these safety checks. You're going to need to have a surgeon in the room that can override if there's any technical issues. So I don't think that these AI surgeons are going to replace the regular surgeons, just the same way that autopilot has not taken away the need for airline pilots, right? The demand for airline pilots, if anything, has gone up in recent years. Even if we've had the technology for many years for an airplane to take off and land without a pilot on board, nobody's comfortable not having an actual pilot on board. So I think that surgery slowly is going to be moving towards that, where you do have a lot of AI automation in place, maybe not for the entire surgery, but maybe certain steps where the surgeon lines things up and says, okay, AI, stitch this to this, and then supervises while that's happening. But it's definitely exciting, and I do think that this is going to be part of the future.